systolic blood pressure and LDL cholesterol were predictive of major cardiovascular events. But the problem is major cardiovascular events include coronary events, stroke, admissions for revascularization, etc. So we sort of dissected these, and we found that LDL cholesterol is highly predictive of coronary events, but not of stroke. Whereas systolic blood pressure increment, every 10 millimeter increase in systolic blood pressure was associated with 16% increase in the risk of stroke, but not of coronary events. So the implications of these findings are that when we look at our patients who might be at risk of both coronary and the stroke, we need to treat both aggressively, reduce their LDL cholesterol in high-risk patients to somewhere around 70 or thereabout, and reduce their systolic blood pressure down to at least below 140, but ideally maybe around 130 to achieve the greatest benefit. The other implications are that people who are designing clinical trials should pay attention to this, because I think when your primary goal is stroke, perhaps we should be focusing more on modifying systolic blood pressure, but when your primary goal is coronary events, you should be focusing more on LDL reduction. But in real life, we know that most patients have both abnormalities, hypertension as well as abnormal lipids. So I think these findings highlight what has come out from previous observational study, but not in a controlled observation like ours, highlight the importance of different risk factors predicting different subsequent cardiovascular events.
Do you think clinicians are aware of this difference?
Well, I think the systolic blood pressure is known to be a powerful predictor of risk of stroke, but I don't think clinicians know as well about that LDL is not associated with increased risk of stroke. And the important message is, for whatever reason, we know that reduction in LDL, particularly when it's quite high, is also associated with significant reduction in risk of stroke, but perhaps by a different mechanism. Pleiotropic effects of statins, as we have seen in the Sparkle trial, that patients who survived a stroke, reducing their LDL closer to 70 was associated not only with significant reductions in cardiovascular events, but also reduction in risk of recurrent stroke. So I think what predicts baseline risk is different than what happens with the treatment. So there are many lessons yet to be learned from these trials.